Do you think a normal chest X-ray rules out lung cancer? Think again. Let me tell you why that belief could be dangerously wrong. I'm Dr. Samantha Herath. I'm a respiratory specialist based in Sydney. I have worked as a doctor for 20 years. And for the last 12 years, I worked as a specialist in respiratory medicine. The majority of my working life has been spent in diagnosing lung cancer, often in people who had no idea that there was nothing wrong with them. Let me tell you a few facts about lung cancer. Lung cancer is the leading cause of death worldwide. In fact, lung cancer kills more people than breast, colon, and prostate cancer combined. In Australia, only 19% of people diagnosed with lung cancer overall survives until 5 years. And why is this prognosis so grim? Because early stage lung cancer doesn't have symptoms. There's no cough, there is no pain, there is no shortness of breath. In fact, you feel fine. You don't know there's anything wrong with you. By the time symptoms like coughing, coughing up blood, or being shortness of breath appear, the cancer has often spread, sometimes outside the lungs, making it much harder to treat and definitely harder to cure. In fact, only 25% of lung cancer is diagnosed at an early enough stage. These are the early lung cancers, and they are often not diagnosed on X-rays. They are not visible on chest X-rays. So this is my critical point. A normal chest X-ray does not exclude lung cancer. X-rays in general are very crude. They're very useful when it comes to diagnosing a pneumonia, a collapsed lung, something major. But they often miss small, intricate details like early stage lung cancers. These early stage cancers can only be diagnosed on a CT scan of the chest. So what can you do? Here's the good news. Australia is launching the National Lung Cancer Screening Program in July 2025. So the eligibility criteria for lung cancer screening are formulated to catch the people who are high risk of developing lung cancer. The eligible people are people between 50 and 70 years of age. They have to be asymptomatic, meaning we are trying to catch early stage lung cancer. They have to be current smokers or ex-smokers who had quit in the last 10 years, and they should have a significant enough smoking history. And this is quantified by pack years. So the people who qualify have smoked 30 pack years of smoking. That is 1 pack of cigarettes per 30 years or 2 packs of cigarettes for 15 years. So how it works is that this is a GP-led program and this is a bulk bill program. So these are preventive measures and there is no cost to you as the patient. You'll get a low-dose CT scan if you meet the eligibility criteria, and if you find anything abnormal, your GP will refer you to the right specialist appropriately. And you are eligible for a screening CT chest every 2 years. And yes, lung cancer screening does work. And we know this from the data from the programs in US since 2013 and also in Europe from a couple of years ago. There's a 20% drop in mortality when lung cancer is detected early. So what is the takeaway? A normal chest X-ray does not mean you are safe from lung cancer. If you are high risk because of smoking, family history, and you're between 50 and 70 years of age and you meet the eligibility criteria, ask your GP about getting a low-dose lung cancer screening CT chest. and get into the screening program. Get screened. It may save your life.